Hello, welcome to FSCDR TV, Warriors Within. I'm your host, Coco. We are here with another episode of with the Sickle Cell Warrior. With this episode, like I said, we make awareness with Sickle Cell Warriors and bridging the gap and making awareness about sickle cell anemia. I have here Anthony. How are you?
I'm all right, and you?
I'm doing well. Thank you for joining me.
Okay, no problem.
So it was us. We got to talk for a little bit, and like I told you, with this podcast, we just like to make awareness. And I want to dive into your story because you have a different, uniquely story.
Yeah.
Between you and your brother, we got to have a conversation. Let's just go ahead and just dive into it. So, are you have siblings, as we talked about? You said you and your brother have sickle cell. So you're the youngest or the oldest?
I'm the second to youngest.
Okay. And it's just, like I said, you and your brother that have sickle cell.
Yeah.
So none of your other siblings have sickle cell.
No, just me and my brother. Other than that, it goes to the nieces and nephews. But just basically in our close family, just me and my brother.
So how was that like for you growing up? Like, you got to obviously watch your brother, but then you going through it as well. How was that like growing up as a child?
Well, growing up as a child, okay. First of all, like I didn't have that much episodes growing up. Like as a child, being to I'm gonna say 9 years old, under that range. But seeing my brother, I still didn't know though, because I was wondering like why he going through this pain. You know what I'm saying?
Mm-hmm. Why he at the
was
hospital?
Younger. He used to be like, bro, rub my leg, and I used to be like, you know what I'm saying? Why, bro? Bro, in pain, you know?
Yeah.
I'm like, oh, okay, bro. Now he let me know what's going on. He's in pain, so I'm rubbing his leg, but I'm still not knowing what's going on.
Mm-hmm.
Feel me? I just know he's in pain.
Yeah.
And then, it got to me where I could say like, at the most when I was real into it. Well, I'm gonna say the end of my 8th grade year, my 9th grade year.
Okay.
That's when I had the.
So the transitioning from middle school to high school, so that had to be really hard at that point.
Yeah, that's when
Because at that point, we going into high school, we start
to graduate.
Yeah, trying to graduate.
Trying to do everything, all the seniors, trying to do everything.
Everything our friends is doing, everything.
And actually, I was into sports, so I'm really trying to be into it.
So how did that work out? So if you played sports, how did that work out with you? You ever encounter any episodes of playing?
Okay, so with me was, I get tired fast. That's what the thing was. Always getting tired fast. I'm never doing what's going on, but as me, I'm still trying to play.
Yeah.
Play tired and all. Like, that's how I was, because I was very, competitive sports. So that's what my head was when I was younger.
Yeah.
I love sports, you know what I'm saying? Growing up playing sports, that was my thing.
So you definitely wanted to go to the NFL at some point.
That was my thing, yeah. You know what I'm saying? And I didn't know that sickle cell can, you know what I'm saying, stop me from going there. No, it's not really just stop me from going there, but it can be in the way of me going there.
Yeah, it put a lot of hindrances.
Yeah.
So how was it? Did your friends understand when you were in high school, when you would get sick, or like your football teams and stuff?
They didn't. My friends never knew anything about it. Cause I'm gonna be honest, I was still at to where I didn't know that much.
Mm-hmm.
I was still naive to a lot of things.
Okay.
You know what I'm saying? But even though I was going through certain things, I would just, like I was saying, brush it off, like I was doing when I was younger.
Yeah.
But my friends, the only thing they used to be like, oh, bro, you have your eyes yellow. And, I used to be like, okay.
Yeah,
I was wondering why my eyes yellow all the time.
Yeah.
But it's like, okay, I drink a lot of water, it clears up.
Didn't
if I
understand.
keep flushing myself,
Yeah.
it clears up. But I'm just wondering, like, my eyes getting yellow. So it's like, it was always like that. So growing up, now I was really like realizing that, okay, yeah, I'm looking at old pictures and stuff. My eyes was always like that, you know? So that's the only thing they ever was saying. They never really knew anything about it themselves,
Yeah, they weren't really aware of it.
Okay, until like I was saying, 9th grade, I had an episode to where I had to miss school sometimes.
Mm-hmm.
And I was out of school for like a whole 2 weeks, And at my school, I had a lot of popularity. Like, I was really popular at school.
So it probably affected you a lot.
Yeah.
Especially, so I always ask this question with my sickle cell warriors. Mentally, I know that had to be really hard.
Oh, of course.
So how did you deal with that? Because you watching your older brother, and then now I know you watching your older brother, and you praying and hoping and praying for him that he pushes through, and nothing like this triggers with you. But then now this triggers with you. So how did you what was going through your mind? How did you cope with it? How did you deal with it?
Okay, so my mom had 7 kids, and I'm like the second to youngest. So I already had brothers and sisters that was older than me.
Mm-hmm.
So I'm going to be honest with you. I was already a little advanced when I was younger, as in to where I was more mature.
Yeah.
You know what I'm saying? I wasn't doing a lot of things that the younger kids were doing. But seeing my brother go through it, keep going through it, it's like, I ain't gonna lie. It been times where I want to cry for him.
Yeah.
You know what I'm saying? Cause like he went through some episodes, you know what I'm saying? And that was the first time like really me catching on to really seeing it when he really going through it.
Yeah.
It's been times where he's in the hospital, like he getting raised by a nurse, you know what I'm saying?
Yeah.
He was in the hospital, we at home, you know what I'm saying? We like, dang, Brian come home yet?
Yeah.
You wondering, like, when he coming home? He come home today? Like, you know, and we was young, so we didn't even know how to deal with that thing. So we all love sports. That was our thing, you know, play sports. I'm sorry, we wake up every morning thinking about sports.
Yeah. That's pretty hard, like you said, considering the fact that that's something you yearn for, and you're probably pretty good at it, and it's, you know that you got these hurdles that is not gonna
let me get there.
Yes,
it's gonna be in the way of me getting there.
So, when did you realize in high school that football wasn't really gonna be?
My 10th grade year, I had to do I had got into a real episode. I had to stay out of school for like a week, and before I went back to school to play the sports or anything like that, I had to wear a heart monitor. I had to wear a heart monitor for a whole week in practice, like doing it just regularly, doing everything I would do.
Mm-hmm.
And when I came back, the doctor was like, he don't think it was gonna be a good idea because I had a heart murmur. You know, and me with dealing with sickle cell, they was like, that would be a whole lot. That's not a good thing for you.
Yeah.
Anything can happen. Collapse, anything can happen out there, you know? So it was hard for me because, like I said, I woke up like football. Went to sleep football. That was us. You know what I'm saying? And even though we played all the other sports too, but football was our thing. Like, and my brother, you know what I'm saying, he was going through it a lot. So by him being in the hospital for those certain days, like, we really ain't we missing him out of our football life.
Yeah.
Because that was our every day. Like I was telling you, all three of us, all the 3 youngest basically, was all boys, and we used to go through it. Like just me and my little brother, the youngest brother, we used to have to rub his legs. You know what I'm saying? And that was tough for us.
But that's good that you guys stick together.
Of course,
you know what I'm saying?
Course. That made us closer, I think.
Yeah, I was gonna say situations like that, it makes you closer because you watching your sibling go through something that you can't even help them control or anything.
Most definitely.
So as we grow up, as you grew up, how did you learn to like transition? Like now you put in your head, football is out the question. Yeah. Now it's real deal. Now we gotta get to life now. Yeah. So because I always ask this, we transition from peds over to adult, you know, so that is a different category when we talk about sickle cell too, because they treat you in the service. It's just different for pediatrics. So how did that work for you? What was going through your mind then when you were like, all right, now I'm an adult, and then I'm pretty sure you've told yourself I can't get sick. I'm not going to get sick, because that's usually the goal.
I can't get sick because, to be honest with you, like, okay, like we don't have any resources for this. Like you can't get, they doing no taking care of you. Mm-hmm. No system or nothing like that, no kind of funding or nothing like that. So you trying to work, but you're missing days out of work, and then your doctors, your bosses, they don't understand that. Mm-hmm. You know what I'm saying? Why? But they know you have sickle cell. You can tell them and everything, but they don't know how that works. Yeah. Because they probably never deal with it. You know, so that's a problem. Like trying to work. You know what I'm saying? That's a problem. That becomes a problem. So it's like, okay, I tried. I graduated, and when I graduated, I went to BCC. I was at BCC for like a year, right? But that whole year, I probably was in school like, I could say at the whole year, I probably only went like 5 weeks out of school.
You were sick most time.
Getting sick then. That's when because it was like I was an adult. That's when I really started getting sick. And missing days. So it's like I couldn't finish that. Like, and it's back to reality now. I gotta get a job still. Yeah. Because you ain't getting took care of. Mm-hmm. You know what I'm saying? And me, I'm not the type that's gonna wait on nobody to take care of me anyways. Like I said, I was always mature, so I have older siblings, and I watch them. So I know I gotta work. But I try to work here and there. I try to work here and there in between jobs. You know what I'm saying? Because of the situation, missing too many days. And then you like, okay, what am I gonna do?
Yeah.
You feel me?
You gotta make ends meet somewhere.
Yeah, you gotta do something. You know what I'm saying? And I'm gonna talk like I like nice things, but I'm not gonna do nothing stupid for nice things. You know what I'm saying? But when you not getting no kind of help, like in that situation, okay, it was 7 of us. Once we get older, you gotta it's time to do what you gotta do now.
Yeah.
You know what I'm saying? And we watching it, so from older siblings, we watching that, so at the end of the day we have to get out there. But I'm gonna be honest, like when I got older, that's like you say, I can't get sick. That's the phase I was in.
Yeah.
I got to do whatever I got to do to not be sick. Like, you know what I'm saying? And, okay, it was working for a while, but then that's when I began to travel. That's when I found out, like, okay, you can't travel anywhere.
So where did you first travel to, and then you start realizing, like, and how did that affect you?
First, it was just Georgia first of all, because that's when was my first time ever been around snow or anything like that.
Oh, okay. So you went during the winter time.
Yeah, so
okay.
Georgia, yeah. When I first went to Georgia, my mom had moved up there first. And like I was just contemplating about, okay, should I go up there?
Yeah.
So I moved up there like probably like 6 months after she moved. And I'm gonna be honest with you, like my first couple of weeks there was okay. But then after going to the hospital, I'm like, and then they don't have any resources anywhere. Like they just got like a clinic that you could go to now. But if you don't know anything about that stuff, like you'll be out of luck.
Yeah.
Going to a regular emergency room, they don't know what you got.
Yeah.
You tell them you have sickle cell, but they know about sickle cell. They was taught because there was a doctor that was the profession, but they never been hands on with it.
Yeah.
So they don't know how to deal with that stuff.
Would you say, since we stay in Florida, and you obviously had health provided care in Georgia, do you think it's a difference?
Yeah, of course. I think because down here is more common.
Okay.
You'll find it more common and more people that have it, you know.
Okay.
But so the further you go up north, it's like the farther you like run into people that have never known anything about it.
So that's where you say that's more of a scarcity. That's why it needs to be more centers, because I do agree with you. It's a lot of people up north that do have sickle cell, but because of the condition and everything, it's not that many, like you said, that many resources for them up there in those regions, and they don't understand. Well, we can't say they don't understand. They understand.
Yeah, they understand, but it's just like they never been hands on with it.
Yeah, and then so for a sickle cell warrior, it's hard for them to relocate to, resources is not available to just move like that. So when you got older and you started getting into the real world working, what did you realize that with having sickle cell at this point, you're like, okay, I'm working, and now I have to make sure I don't stay sick, and I have to take care of myself. When did it finally hit you that it had to be when you was in Georgia? So I'm guessing this had to be this hospital stay.
Basically, yeah, because you're like, okay, I got an apartment now. You feel me? I got my own car, and I got to keep that. I got bills. You feel me? So it's like, I'm missing a lot of days out of work. Eventually they're gonna have to let you go, because that's not what they need there. You feel me? You try to get there and try to make it happen. Some days I went to work hurting, like in pain. You feel me? Some days, a lot of days, I just try to brush it off. Like I used to start in my back, my lower back area. I used to try to brush it off all the time. Like, and that's what it hit me in my back, like crazy. It's pain. It's a pain you can feel all over in your whole body type thing.
Yeah, yeah. Like, I understand.
Yeah, it's pain like to where you don't know, you can feel it coming on. You can feel yourself, you know what I'm saying, getting towards a crisis or something like that. But when it comes, sometimes it comes out of nowhere, and it's like
it comes hard.
Yeah. You feel me? So it's like you got to be in the right place at the right time.
So when you got sick in Georgia, how long did you stay there?
Well, I was in the hospital for like the longest I was in the hospital for Georgia. I was in there for like a good 3 weeks.
Was that like your longest hospital stay ever in a crisis?
No.
I feel like every sickle cell warrior has a hospital stay that that was the most.
Okay.
Which one of your crises?
Mine was when I was in New Jersey.
Okay.
I went up to New Jersey. I was in New Jersey visiting folks and got into some trouble. And I did some time in New Jersey. I was up there for 6 years. No, actually, I was in New Jersey for 3 years. I was up in Atlanta for 3 years. Mm-hmm. But I was in New Jersey for 3 years, and when I went in the hospital, I was in the hospital for like, I was bad because that's when Georgia got snow.
Mm-hmm. But Jersey got snow.
Jersey got real snow.
Yeah, they do. It's cold there. Yeah.
And they got this thing to where you got to go out and shovel the snow. You don't shovel the snow, you go to the hole. So I'm like already like, okay, send me to the hole.
So they would. That was the setup. Wow. Even
you don't shovel the snow, you go to the hole.
So
they don't care about the sickle cell. They don't know about. Too many people don't even. You can tell them you like, okay, yeah, and they like, okay, yeah, and that's what it is.
Okay.
You know what I'm saying? Mm-hmm. Until they see you really going through something real bad, then they're trying to figure out what's wrong with you, but they still naive to it.
So even being in the correctional facility,
yeah, that was tough. Like it had to be to the point. One time I had to be like it was snowing, I had to be shipped out, and when I was up there, I was in the hospital for like over a month, over a month.
So that was when you had your time to realize, like, listen,
yeah, man, I can't be just anywhere. I'm all the way in New Jersey, no family up here. Like, I just can't visit parents. None of them ain't coming to no hospitals.
Yeah, you know nobody coming. For sure.
So you up there basically got to fend for yourself. So I'm handcuffed to a bed, like in pain.
Yeah.
You feel me? For a whole month, like I'm in pain, like, and that's why I had the flu. I guess that's what I call it. That's why when you have sickle cell, you have to look out for everything else.
You do. Little things, like you said, like flu, colds, you can get stuck in the rain.
I'm talking about that's what I guess kills a lot of sickle cell patients off when they get acute chest syndrome. Yeah. And that's coming like from different colds and stuff like that, pneumonia. Mm-hmm. You get that, and you can like, it's basically like, that's when you. Yeah, it's serious. It's real serious for you.
So is that what you caught when you So you had acute chest syndrome?
Acute chest syndrome.
So it started with pneumonia.
First time
it started
ever
with cold
that
first.
Like that.
Oh wow. So yeah, I could. Okay, so I can. So mentally, you was really going through it. You not only incarcerated, you sick, and you in the hospital for a month, chained to a bed, and
can't use no phone. Don't know what I'm saying.
Yeah.
Can't call my parents. Let them know what's going on, cause like they just. That was really my time. I was really mentally like having to really think about it. Like stay strong. Like you finna get through this.
Yeah, because I was gonna ask, how do you cope with that? How did you cope with that mentally?
Man, and it's like being that I was at that age, I was around like 20, 26, 27 around that time, and I know at that time I know what medications I take and everything like that. But me being in Jersey, they want to give you like I'm saying, doctors never was hands-on with that type of stuff. Yeah. So they want to just give you anything. And I'm like, doctor, you can't just give me anything that's just not going to work for me. Like, you know what I'm saying? They don't listen to you for that.
So what were they prescribing you?
They tried at first, they'll try to give you Tylenol, just to
regular Tylenol. And that don't work at all.
I'm like, Tylenol? Like, are you serious? Like, only if you know what I'm going through. Yeah. You'd be like, oh, Tylenol, that's crazy.
Yeah, I'm saying it's crazy because I'm pretty sure your normal doses would probably be either morphine or what.
I was getting Dilaudid.
Okay.
You know what I'm saying? I had to get Dilaudid because like morphine, that was burning in my veins. That wasn't doing nothing for me, just burning in my arms. Okay. It wasn't no good for me, so I was like curing it was doing nothing for me. Everything else didn't work.
So in your stay for that whole month, did you make an awareness to them? Like, how did you let them know, like, hey, obviously you can't let much be known chained up to a bed because this is the way I had to get. Like, I had to write one nurse one day. I had to write a letter and let her know my situation. She seen me with a police officer every day though, like in the bed with a chain, but I couldn't talk because I was like out of it. You know, I was in pain every day. Yeah. So I wrote a note. I came to the point I had tried to write a note, and I wrote a note for her to call one of my family members. She called my mom for me. That one nurse called my mom for me and let her know where I was at. Cause my mom probably was wondering, like, where is he? Yeah. I know he's incarcerated, but, like, where is he? Yeah. She was probably hear from me, you know what I'm saying? And nobody wasn't hearing from me. So, it was like, when I wrote that note, the lady, she really reached out to my mom for me.
And my mom ended up talking to the doctor that was on call that day, and that's when he really got my meds to where I could really get what I need to get, and that what brought me back to, you know what I'm saying, getting back to health and getting back out of there.
Did you feel like you wasn't gonna make it?
Man, I'm trying to tell you, it was some times I was like it was so painful. My best thing to do was try to sleep every day.
Mm-hmm.
The whole day I wasn't eating nothing. They bringing food. I was never eating anything.
So how did you you survived, but how did you make it through like your incarceration time?
Man, that was, I ain't gonna lie, that time after that month, I really had to, I couldn't, they moved me to another facility. It was an inside facility. I wasn't going outside. I wasn't doing anything. I was standing inside. I never go out the door. I just try to stay warm, much as possible. That was the best thing for me, to stay warm. So I had like I told you, they gave me like a whole thing of Tylenols. I could take like whenever I want.
Yeah. That does nothing. It doesn't.
You know me? So it was like, I just gotta just do what I gotta do. You know what I'm saying? To get out of here.
Yeah.
Get back home. That was my best thing to do.
Yeah, because that's really all you could do.
Of course, man. Like being up there, you so many miles away from home, and you got a sickness that people not used to seeing.
Did you have any other people that you met while you were incarcerated that had the same thing, or no?
No, I didn't.
So you were the only one.
That's the crazy part about it. Like I didn't meet anybody else that was like that had it.
So with this experience that you had, where do you see that people who are incarcerated that have sickle cell, where they could get help at? Because that is unfair.
That's why I think, it's not, I was telling you before, it's not talked about enough.
Mm-hmm.
You know? And maybe some certain people need to hear it from people that I guess that can probably put themselves together to talk to where these people, because at the end of the day, people have to understand you. You know what I'm saying? First of all, you have to understand, be willing to understand you.
Yeah.
A lot of people not willing to understand what's going on with us. And I just think it got to be talked about, man. Like, you know what month breast cancer awareness is. You know what month for everything else, Mother's Day. You know everything else, but you don't know when Sickle Cell Day month.
Yeah, for sure.
A lot of people don't even know nothing about this.
Yeah, I agree.
And people don't, like, now I know, like, you can't just have a baby with anyone.
Mm-hmm.
Because you wouldn't want your kids to go through that.
No. Yeah, you have to be very mindful.
Be careful of who you date, everything.
So it probably was just like a whole complete eye opener for you when you got locked up and everything. You were just probably like, this is a whole.
Yeah. That's when I used to be saying, now I'm like, dang, this is what my brother was going through when I was young.
Yeah.
Like, this is crazy.
So now you got to see it for your own experience. How did that make you feel once you got to empathize at that point? Now the shoe was on your foot.
That was tough. I told you, like, that was tough. Cause I'm gonna be on, like, the last couple of years now, it's been okay for me. I've been able to work, you know what I'm saying, do what I have to do to make ends meet. But who knows when that next thing can happen?
Yeah, for sure.
And once that happens, it's like, okay, I'm in a situation now, I'm losing things. Because, finances, they don't want to hear nothing about that.
Yeah.
People don't want to hear nothing about that.
Yeah.
They don't care nothing about that.
No, and not at all. And they don't, a lot of things that's not really spoken about with sickle cell, like, a lot of people aren't aware that that's considered a disability and you're supposed to, you know what I'm saying, getting compensated for that. Exactly. So I came to that conclusion. A lot of people don't understand, like, that's a resource. Even when it comes to schooling, like, they have a special schooling form for people who have sickle cell. I homeschool my kids, so that reason why, so he won't miss school so much. And so even with stuff like that, like I had to find the resources for that. But like I've told you before, it isn't until you have an engagement or a conversation with somebody that's in that community or going through it, you won't really know these things. Because I didn't really know these things until I started, engaging with other sickle cell warriors to understand, like, hey, these are other opportunities for my son, because you don't want that to for especially when as a kid you sit there and think about it. So I totally get it. You were probably running around looking at all your friends play.
Why you can't play?
Exactly.
Like, why you can't do this? But and I know your kid right now. He's probably like in that stage right now to where like why I can't do certain things.
Mm-hmm.
And once he get older, that's I think when most of us start to like research it, like, cause we got to know now.
Yeah.
I'm older, anything can happen.
Yeah.
You know?
I feel like with a lot of sickle cell warriors, I always say this, like I said, every episode, y'all are the strongest, most resilient people I've ever met. Y'all mental is just beyond. The wisdom is just beyond, and it's like I don't even know how to explain it. Like when every encounter I had with a sickle cell warrior, I've taken something knowledgeable and something away from it. Not even that, spiritually grown from it, because I feel like I've always said, you guys are in a 4-wall box, and that's just you time at that point. So it's nothing else. So with, like I said, with everything being said, like I said, you guys are in 4 walls, and it helped you grow mentally, spiritually. How from that day on? Because like I said, that was a lot. That's a long time in the hospital, especially like I said, being in those conditions. I feel like that's so. Spiritually, where can you say that has like having this condition? How has it helped you grow and taught you?
Well, I this is my thing anyway. Spiritually, like I grew up in the church, so praying is always one thing I've been doing. We was taught to do that. And that was, I'm gonna be honest with you, at that point in time, that's the only thing I could do.
Yeah.
You know what I'm saying? Because they don't, like I'm saying, I'm in the place that they're gonna overlook all this.
Yeah.
So when I'm in pain, I could be locked in the cell for a whole couple of days, and they
overlook.
They walk past you. As long as they see you breathing, they keep going. You know what I'm saying? So.
And I'm pretty sure it's plenty days you was curled up.
Man, you got to be tough. I'm gonna be. It make you tough.
Yeah.
You know what I'm saying? When you like going through so much pain like that, it's like, dang, what else can I go through?
So how would you say like your support is? Because I always encourage, and I always know a lot of sickle cell. To have sickle cell, you have to have support.
Our support, I'm going to be honest with you. Being that my family we were a very close-knit family. Like, I'm going to be honest. Like, we really, really, brothers and sisters, like, call each other every day, talk to each other every day. That's us.
That's amazing.
You feel me? I can honestly say, like, 7 of us, we all communicate well, you know, we all could talk to each other, like, so that was our support system, family, you know what I'm saying? And if a lot of people don't have that.
Yeah, it's true.
A lot of people don't have that, you know what I'm saying? Well, a lot of people have families, but a lot of people don't have that close-knit family.
Exactly. Because a lot of people is in that get in the hospital,
they move out their separate ways, and they gone, you know, that's how it is.
Exactly.
So I'm glad I got a family like that, just, like, we like to be around each other a lot anyway, so, you know,
That's good.
That's our really support system. And me growing up in the church, like, that helped me a lot too. Because praying, like, believing in God, like, I had to pray, like, every day.
Yeah.
Like, you know what I'm saying? Yeah, I'm in pain, but I gotta try to make it through. You know what I'm saying? I'm not giving up like that. And that's always been me. Just you gotta fight. If you don't fight, nobody gonna fight for you. You know what I'm saying?
Not at all. So how long did you say you were incarcerated for?
I was incarcerated. I did 3 years in New Jersey.
Okay. Yeah. And when you got out, you didn't stay in New Jersy. I'm sure you came
I had a flight set up the same day.
You came right back to Florida, right?
I had to get from up there because it was when I got out of there. My mom sent me a jacket and everything, but my jacket, like, down south clothes, it don't work up there.
It does not.
It don't work up there at all. So on the way to the airport, it was cold.
Yeah.
I gotta get up. I gotta get from up here.
Yeah.
Like, I was running to the airport. Like, I got to the airport ASAP and got up out of there.
So I know your mother was more than excited to see you when you got home and hug you, especially finding out she can get to hug you when you were sick and stuff like that.
Like, nobody was up there. So it's like, that was crazy time for me. That was really like, I just couldn't panic. You know what I'm saying?
Yeah. Cause
most people would panic. You know what I'm saying? But I ain't panic. Like, I had to be strong. Like, and get home. That was my thing.
So, with a large family like this, because you said 7 siblings. Mm-hmm. Is your mom a single mom?
Nah.
Okay, so your mom and dad married. So how did your parents grow to know, like, with the knowledge of this, like, to become aware of it? Because that's, like, again, this is something that we grow to learn about, really. Because once you have, like, your baby got sickle cell, it's no manual like how we talk about. And it's not like we can go to, like you said, like how cancer centers have a whole thing set up. It's not like that for us.
Right.
So how did your parents grow to learn and make awareness? Obviously, your brother was the first one.
Yeah, I think that's who they learned most of it from, him, because him being intelligent how he is, like he knows, like he studies this stuff. You feel me? And I think, like, real thankful that I got him, because I at first I wasn't even paying attention to, like I was saying, paying attention to my health like that.
Yeah.
You feel me? And after the episode, that made me pay attention. I had to pay attention, and I had to just take it serious. And I started asking him a lot of stuff about it, then started looking it up on my own. But they really learned it from him, though. Like, my mom now, they all learned it from him.
That's good.
Yeah.
Somebody got to be the walking book in the family.
Yeah, basically, yeah.
Yeah, somebody.
And that's how I feel like, that's why I was saying, like, doing a podcast, doing everything else, that's the good thing for that.
Yeah.
Because when you're young, you don't want to even talk about this stuff.
Yeah.
You're like, well, I'm going through this stuff.
Yeah.
And sometimes you in pain, you can't even talk about stuff.
And it's good to hear it from other people, because you always think that you're the only one going through it.
Yeah.
But little do you know, you're not the only one at all. At all.
There's other people out here just like me.
Yeah. Yes, you know for sure.
And that's what.
So
it gets serious.
When it came to growing up, and like you said, your brother, you learned from your brother's experiences. I want to say, as far as it came to, like, relationships, how did that work out for you?
With me,
because you did say you have to be mindful of
who you date. Yeah.
So that must mean you probably had it. Yeah, that's always a trial.
Basically, yeah. Everybody out there, you got to tell them, like, you got it, because they don't even. Some of them, they don't even be knowing.
Yeah, for sure. Yeah.
You know what I'm saying?
For sure. A lot of people I've talked, they don't, like I said, a lot of warriors I talk to, they make it very it's hard to date, because a lot of people aren't really educated on it, or they kind of think it's like it's like a cooties type of thing, and it's not, you know.
No, at the end of the day, like, you gotta think about it. You gotta have, like, you have HIV out here and everything. You gotta really ask these people, man. You can't just be scared. You gotta ask these people.
Yeah.
If it's my partner, you gonna trust me. You gonna love me. You gotta be willing to hear me out. And let me, like, basically give you the knowledge of what it is.
Yeah.
You know what I'm saying? So you could check on yourself to see if you got anything like that. You know what I'm saying? The traits or anything. But not only just to check on herself, like, you got to ask questions, basically.
Yeah.
You feel me? You got to be very vocal, and you got to ask. You got to find out, like, okay, do you have it? Because I'm going to be honest with you, like, dang, I don't say, you know how some people say love at first sight, right? Mm-hmm. You can meet some people like that. It's possible.
Mm-hmm, for sure.
So what if you meet somebody and then you like, dang, I like this person already, but she don't. I'm letting her know now she has sickle cell. I found out she has sickle cell, and you know that ain't even a good look. Mm-hmm. Cause you like, dang.
And you think about the barriers.
I'm not trying to have no kids growing up through that, like, that pain and that suffering, like. That just put more on your hands. Yeah. You know?
So I'm pretty sure that didn't cross your mind playing.
Of course, man. Like, you got it. Like,
so now that like, you know, that you at this point in your life, what is something that you really, like, hope for, or that you want to make an empowerment, impactful change towards sickle cell? I
just think that we need to be treated better, like, because it's some hospitals that they just like don't like to treat. It's like you're a regular patient like everybody else.
Yeah. For sure, and I'm pretty sure, because like I said, continuous episodes, we done go over this. They definitely think you guys junkies.
Yeah, they don't even know what's going on, and they don't even know, like, you going to hospital. Like me, okay, I'm trying to, like I say, I work, so, you know, at the end of the day, I got to stay healthy. But if you see me at the hospital this day, it shouldn't matter.
Yeah.
You know what I'm saying?
I want the same I want good treatment.
I got sickle cell. Like, it ain't like I just caught this yesterday.
Yeah.
Like, I was born with this. So y'all should be, it's what, 2024. You think, like, they got flying cars right now. Yeah. You feel what I'm saying?
Yeah.
So they should be up on every health. Like, you know what I'm saying? Every health defect, every health problem. And sickle cell it just get overlooked. Like, you know what I'm saying? Basically because of the skin color. It's a black man disease. Like mostly black people have this.
Yeah.
So and that's something you have to respect. But at the end of the day, it shouldn't be like that.
No,
that's
for
bad,
sure.
man.
It is. It's definitely.
There's no centers for. It's not really centers for us. Like no like researchers for us to get information. Like you gotta just basically do this stuff yourself.
Literally, I've gotten all my knowledge. Like I said, if it wasn't from other encounters, if it wasn't for the Foundation of Sickle Cell Research, which is Dr. Bronte and Dr. Blyden, right. But if it wasn't for either one of those two, I was not getting as much, like you said, resources. Because even from my son's hematologist, I was getting minimal resources from there. So I completely understand. Yeah. So going forward, because I feel like you have like a real positive reinforcement. I feel like you do really great with kids.
Oh, yeah.
So I feel like that somewhere along the line.
How you know that, though?
You can tell. Energy don't lie. But I can definitely see you moving some reinforcement structure with sickle cell with kids and athletic.
Like I was just talking about opening up a youth center just today on the phone with somebody.
Yeah.
Like I was just talking about that today, like, because that's really what I want to do. Like involve spiritual and church and everything. I don't want to pound it into their head and nothing like that. But I want to give them knowledge on everything, though. Yeah. Not just sports and not just God, you know what I'm saying? But I want to let them know sickle cell, cancer, HIV, however you deal with it, you know what I'm saying?
Yeah.
It need to be talked about more, man.
It does, because
you know what I'm saying?
Looking at the kids growing up, like it's
overlooked.
It's overlooked for sure. Like I go in the hospital and I see those kids like in the room, and I feel bad because like they missing out on cool event, you know what I'm saying, on things that they could be outside riding scooters, riding bikes and stuff, and 9 times out of 10 they feel like they're alone. So I totally, when I hear you talk, I definitely see that gateway in you and that festering for you. So with that being said, because we did say a lot, but to go back to what I was gonna say, so where do you see, since we are in 2024, we are gearing towards new medicines and new things we are slowly progressing. What do you hope for we're gonna say near future, because we're gonna pray it comes sooner?
Yeah, basically it's just like you say, we gotta get the word out to the youth. We got to promote it more. We got to let people know what I'm saying? Don't overlook this. Like this is serious. Like this is something people die from. Yeah. You know what I'm saying? It's sad to say, but that's people die. Certain people die from it. And we got to get the youth. We got to get the youth, because at the end of the day, the youth is the ones that really don't know what they're going through. Yeah. You know what I'm saying? So we need to basically, in the near future, I want to basically get that crowd of the youth, and basically coach, be they coach through this. You know what I'm saying? Let them know that you don't got to be feeling bad because you can't be out there playing sports, and basically that keep their mental going. Yeah. You know what I'm saying?
Yeah, because they need it. They surely need it.
That's why our world today is like crazy. Like it's a lot of people just running around out there don't know what's going on.
Yeah, and like our kids, this youth is what's gearing for us. So I totally agree. I thank you for coming on this podcast today. You have shared so much information, and it was great talking to you. And I wish you nothing but the best. And I pray you actually start your resource center for these kids, these sickle cell kids, real soon, because they need positive reinforcements like you. Yeah. So thank you for joining. And that
my pleasure. Thank you.
No, thank you.
All right.